Woodlands Sports Medicine Center, this is Lindsay. How can I help you?
Hi, Lindsay. I had called last week trying to make an appointment with Dr. Kim, and I was informed that I would need the past visits from my former pain management clinic before she would even consider allowing me to schedule an appointment.
Yes, sir.
I had been living in Northern Virginia and have been forced to come back here to my home state of Texas recently because I'm disabled again permanently and spend most of my time in bed. And unfortunately, in this state, my home state, for which I am now profoundly embarrassed, it is next to impossible to find anyone who will just treat me like a human being. And I'm sure you've heard this before, but whatever. I mean, I don't take it personally. I'm exasperated at this point because I've been dealing with this particular injury for 30 years, specifically since May of 2006. My spine is bent and twisted. I have so much damage, and I live in pain every day. And I just need somebody to schedule an appointment, and they use provider flow, and these people are telling me 2 to 3 weeks. It's absurd. I've been trying to get an appointment, and I guess I should have started with this. Have you guys received anything from provider flow or anyone by the name of Christopher Kadelka?
Can you spell that last name for me?
Sure. It's capital K, no, sorry, K as in kilo, O-U-D like Douglas, E like Edward, L-K-A.
Okay. All right. And that first name again, so sorry.
Christopher.
All right. Okay, give me just one moment and let me check a few places, okay? Give me
Awesome.
just one moment.
Thank you, John. Thank you.
Oh, and what is your date of birth?
March the 30th, 1966.
Okay. All right. Give me just one moment.
Thank you.
Thank you for calling the Woodlands Sports Medicine Center. Sorry to delay your call. Please hold.
I'm sorry. Thank you for holding. My name is Karen. Is this Mr. Kadelka?
Yes, ma'am.
Okay. So I did a little bit of research helping out Lindsay, who you were speaking with earlier.
Thank you.
And they do have your records, and Dr. Joyce Kim approved your case. So what is the nature of your visit with Dr. Joyce Kim?
I've had to move back in with my sister. You know, I'm 1,600 miles away from my pain management. I need my medicinal regimen. I mean, I'm a disabled person. I used to be a runner. I try to be as active as I possibly can. But you know,
all I'm asking is that what body part or
it's my entire spine. And when I say that, I'm not hyperbole. I suffered. I'll be really succinct. I fell off a building in 1989 working construction. All right, and then in May 9th of 2006, I was forced to have more epidural spinal injections before anyone would give me surgery, and no one would prescribe me any adequate pain relief. So I was desperate, and after the second, there's supposed to be 3 injections in my cervical spine. After the second one, I woke up in the middle of the night with muscles. It felt like muscles tearing apart in my back. My entire right side is smaller than my left. I had just run the Cherry Blossom 10-mile road race.
Okay, well, let me finish up your profile real quick, and then we'll get you scheduled. So basically, you have full body pain. Is that correct?
Yes.
Okay. So let me get a little bit more information from you, and we'll be good to go.
Awesome. I appreciate it.
So this number here, 703-944-9747. Is that a good number, sir?
Oh no, that's a really ancient one.
Okay. What is your cell number?
I must have come here before in the past, and I don't remember. My best number is 281.
Thank you for calling the Woodlands Sports Medicine Center. This is Alex speaking. Can I help you?
Hi, yes, ma'am. I'm calling to confirm an appointment.
Okay, the date of birth?
March 30th, 1966.
First and last name?
Christopher Kadelka.
All right, so you have 2 appointments. You have June the 9th at 8 o'clock with Dr. Kim.
Yeah, I'm calling to verify that. You can cancel the second one that I think is on the 23rd or the 29th or something.
Okay, cancel
Yeah.
that one.
Yeah, they were so awesome. I'm a new patient, and I was in need, and they put me in, so they're awesome.
All righty. Well, we'll see you tomorrow at 8 o'clock.
Yes, thank you. Bye-bye.
You're welcome. Bye-bye.
Hello?
Hi, this is Christopher.
Yes, ma'am. Hold on
Hi,
one
this is
second.
Ken.
Let me turn this off. Okay, sorry.
This is Kendall calling from Dr. Kim's office.
Thank
I left you a few voicemails last week. I just wanted to verify that you received them.
Yeah, actually, and I called first thing this morning and verified that with the appointments desk.
Okay, great. So you can come in tomorrow at 8.
Yes, ma'am. And I want to thank you from the bottom of my heart, man. I desperately needed that, and I appreciate it.
Yeah, of course. Luckily, we had someone cancel, so
Yeah.
it's no big deal.
Yeah.
Alrighty, well, let's see. Okay, and it looks like we have your MRIs and everything, so you should be good to go. And we'll see you at 8 tomorrow.
All right, yeah, and I got the link, and I'm preparing a bunch of, because I'm a complex patient, so I'm going to try to make it as easy as possible for the doctor.
Yeah. If you can fill out the online stuff before, it'll save you a lot of time, and then we just have a few specific things to fill out on paper when you get here.
Awesome. And just one last point is, like, the reason I didn't answer is I have T-Mobile. I was actually surprised because I'm back in the room that I stay in, and the phone actually rang, which totally surprised me just now because it never rings, and that's why I don't get messages. I apologize for that.
Yeah, no, I noticed that, so I just wanted to just verify.
Awesome.
Alrighty, well, we will see you tomorrow then.
Thank you, ma'am.
Of course. All right.
Bye-bye.
Bye-bye.
Who's your primary care doctor here? Why is she testing you for HIV?
She said it's normal. I told her I haven't had sex since 2006, and I was clean then. This is kind of pointless.
Was there a history of IV drug use? Or?
No. Hell no. I've never presented anything, although I've been treated like a filthy drug addict, I've never presented any evidence of ever even.
And so that's not what I would consider a typical.
Down. I do everything on my back.
Okay. As far as the medications go, I don't think the hydromorphone 4 times a day and the morphine at night was unreasonable. But it doesn't look like anyone's prescribed you anything recently. Did someone give you something, or?
No, it's because no one in the state of Texas would take me as a patient, and
Okay.
even though I
So
came
where
down
are you getting?
with my,
No, I understand. But,
with my prescriptions, and they would not
that
take
aside,
them.
where are you getting your pain medications now then? Because you tested positive for opioids.
Of course, I
So-
take opioids.
So where is it from?
What are you implying?
No, well.
I
no
told
one's
you guys where it's from. I gave you a list of my doctors.
Okay, but the last time it was prescribed was back in March.
Yeah,
So is that left over from 3 months
there's
ago?
no leftover. This is 3 months of pain and not being able to get out of my bed because I had to ration what I had.
Okay,
Because
so
no one
no,
would
so it is left over. That's what I'm saying. It's medication that you got back in
I
March.
couldn't get refilled. I went last year. I went
Okay,
6
sir.
times
Okay.
round trip to Northern
So,
Virginia
Chris,
just to get it
hold on
filled.
just a moment. I understand you're very angry.
No, I'm not.
But
When
this
I get
is
cut
our-
off, when you're asking me a question,
But this
I'm
is
trying to
our
explain it.
first visit, and
I
part
know.
of the visit is to determine if I will accept you as a patient. So I'm trying to sort out all these things so I can make a case for saying we're going to continue this. So the fact is, the last time you got the medication prescribed for you was in Virginia for your doctor. And I know you had difficulty getting it at the doctor in Texas. Okay. But you
No,
did
you're the first one that's wanted to see me.
So you tested positive for opioids. So I just need to know, is it from your prescription in March?
Of course.
Well, there's no of course, because what my patients will tell me was, okay, my sister also has pain and I took some of her.
No,
That's
I don't
fine,
do that. I don't do that.
But it's not necessarily wrong. Okay, I understand that family members will help each other out and say,
That's not
"You have
happening."
a pill." But don't be mad. I'm just saying I understand. I just want to know if that was the case.
Then just ask me straight out.
Well, I did ask you. And then you got mad. So
No, I
just
didn't get
wanted
mad.
to
It's
know.
just that
I just wanted to know if you tested positive for opioids, was that from your last prescription?
Of course.
And it's not an accusation. It's just because I document that you test for positive for opioids,
As you should.
and the chart says last time we got it was in March, and it's June, and it's
Yes.
supposed to be a monthly prescription. So we're
You're right.
in between.
You're right. Therein
So
lies the torture.
So you've been rationing. So like one pill a day, or what have you been doing?
Cutting them in half, taking as little as possible.
Okay.
And-
Any problems with withdrawals recently? So diarrhea.
No, I already went through all that. I went through that. I was forced to go through that.
Okay. So we can go back to the hydromorphone 4 times a day and the morphine at night. I don't think that's unreasonable for what you're going through.
Yeah, but I actually don't want the morphine at night. And what I want to do actually is not go back to 4 times a day initially because
Your tolerance has gone down a little bit.
well, it's not just that. It's I don't want because I plan on getting to the bottom of everything, and so what I found 2 years ago in this December of 2018 when I first went off everything. That my body had gotten a lot worse, and it was masked by the medications I was taking.